Hello, everybody. Coach Nick here. Today, we are going to talk about breathing mechanics. Breathing has gotten a lot of attention lately, and rightfully so. Breathing is really, really important. But often it's looked at in the standpoint of physiological processes, right? We bring oxygen in, we expel CO2 out, and we look at it, the relationship it has to do with stress and how we can improve our aerobic capacity through our breathing, how we can use it to help calm ourselves, and the treatment of some, mental health issues that we may be suffering from. And I think that is really, really important. But I think what's often overlooked is the mechanics of breathing, how we breathe and how it affects our movement and how it can, correlate with pain and decreased range of motion. And I think improving the mechanics in which you breathe can directly improve how we feel. So I'm going to introduce a concept today that some of you may not be familiar with, and I want to introduce it first because we're going to keep referring back to it moving forward. And I think if you can get a good grasp and handle on this concept, it's going to change the way you look at breathing and the way you look at movement, because I know it did for me. This has been one of the more important theories or concepts in movement that has really helped me as a coach and to understanding movement better and just improving outcomes for not only myself, but for my clients and my patients. So I've learned this from Bill Hartman out at IFAST, I believe he's in Indiana, and just from his all the content that he puts out, but he puts the content out for physical therapists, and I kind of want to put it in a manner where we can all understand it, because I want to make this stuff accessible to everybody. So when we breathe, right, so what I have here is a skeleton. Here's the rib cage, and here's my pelvis. Here is my diaphragm, my thoracic diaphragm, and here's my pelvic floor diaphragm. This is the spine here and rib cage, and here's my abdominal wall. So when we inhale, right, we bring air in. So it's been, before we, hold on. It's been agreed upon that we take 17 to 23,000 breaths per day. To me, that is a lot of reps, right? Can you imagine squatting 23,000 times a day? And the manner in which you squatted isn't the most effective and efficient way to squat. So if we can improve the mechanics of our squat, we can squat better, we can feel better. If we can improve the way we breathe, we can breathe better and we can move better. Just a side note, breathing is only part of the bigger picture, but I think it's really important because 23,000 breaths a day, you live to be 85, that's a lot of reps. We come in on an inhale and we leave on an exhale. To me, that is a lot of reps. And if we can help people or help ourselves become more effective and efficient in our breathing, it's going to have dramatic effects, okay? So when we inhale, right, air is coming in to fill up our lungs, right? So as the air comes in, our lungs should expand 360 degrees, right? We should get air coming in. The diaphragm is going to come down. The pelvic floor diaphragm actually will match the thoracic diaphragm. So all these little green arrows is the air coming in. We'll push the thoracic spine that way. But as this diaphragm comes down, we also push the lumbar spine that way. What else happens is the pelvis will posteriorly tilt. And the reason it does this is to accept the internal organs which are being pushed down by our thoracic diaphragm. So that is where we start to see the abdominal wall get pushed out here, right? So we often hear like belly breathing, and I don't like belly breathing because the lungs are up here in the rib cage. And what usually happens when people belly breathe is that they will actually just push their belly this way, and they increase the curvature in their lower back. But as we just saw, as the diaphragm comes down and this pressure starts to be exerted down here, the lumbar spine should go that way. If you push your belly out this way, it's going to pull the lower back that way, but we want it to go that way, okay? I know there was a lot of this ways and that ways, but as you can see, the diaphragm should come fully down in a effective and efficient breath. And we call this an expansion strategy, right? Because things are expanding. But what happens is, let's get to the exhale before we go into the expansion stuff. Now the exhale is the exact opposite, right? The air is coming out, so these arrows reverse. The diaphragm comes up, the thoracic floor diaphragm comes up, the lower back's curvature increases, the thoracic spine will actually come in a little bit, abdominal wall comes in, and then the pelvis will tilt anteriorly because the spine's connected to the pelvis via the sacrum, right? So now we have that. So this exhale strategy is called compression. So if you exhale all the air out, you should feel everything compress. What happens is people have one or the other, usually a mixture of the two strategies. So when they inhale, we'll actually see expansion in certain parts of the rib cage and we'll see compression in others. A real common one is that we'll see a lot of expansion into the front part of the rib cage, but we'll see a ton of compression in the rear part. So you have to think how that might affect, things like the shoulder blades, which sit on the rib cage, and things like the femur. Remember, the pelvis and then the femur is what actually makes up the hip. So if this, we see anterior tilt in a lot of people. If people are always in anterior tilt, think of what that may do to the muscles attached to the femur and the pelvis. So, the quads here in the front and the hamstrings here in the back. If we tilt that pelvis and we're always in that state, we now have super long hamstrings and we might have tight quads, right? So if we can improve the manner in which we breathe and we can improve the movement of the spine and the pelvis and the rib cage, it's going to have a ripple effect from the inside out. So start to look at breathing, and really, I seriously want you to think about this all day, is that when you inhale, things expand, and when you exhale, things compress. Because as we move forward with the breathing mechanics, you're going to see how we can take advantage of this in when we're programming. We can put people in certain positions. If we have a lot of expansion but not much compression in certain areas, we can put people in positions where it would compress and compress those areas, and vice versa. So hopefully that was helpful, and hopefully you can use this, in helping you improve the manner in which you breathe. If you have any questions, shoot me a message, and I appreciate you for watching.